Hi, Dr. McGraw.
Hi.
Hi, I'm Jean.
You're Jean. Hi, Jean. It's good to meet you.
Nice to meet you.
You must be Suzanne?
Suzanne, that's right. Nice
yes,
to meet you.
Dr. Margaret McCraw. Please call me Margaret.
Okay.
Okay, come on in. Okay, have a seat. There you go.
Thank you.
Do you have any trouble finding my office?
No, not at all. Thank you.
Good.
It's
Okay.
easy.
Great. Wonderful. Wonderful. Well, today, the very first thing I want to talk with you about is confidentiality, so that we can create a safe space to go forward in our conversation today, okay?
All right.
So these sessions are completely confidential, and I know that I do have a rapport with the organization, and I want to just put that on the table for you. I work with your organization around leadership and doing some coaching and work with them on some of their training. So I do know your boss, Jean. This conversation we're having, though, would not go beyond this office. I want to be sure that both of you know that. And then, of course, I would expect the same with the two of you, that you would keep the things we talk about here totally private between us.
Absolutely.
Are we in agreement?
Sure.
Okay. The only time confidentiality, there would be an exception to confidentiality, would be if you were ever gave me the impression that you were in danger of hurting yourself or somebody else, okay? Okay.
Yeah.
And that's important for coaching, that's important for counseling, and I would tell you if I ever had that impression, okay? But other than that, it would remain confidential. The other thing I want to talk with you for just a moment, and then we'll get into our session today, is that coaching is different from counseling. And a lot of people get the two confused, the two disciplines confused, and they are different. Are you familiar with counseling? Is it something, okay. And have either one of you ever done coaching before? Business coaching?
No.
No? Okay, so this is no. So coaching is different from counseling, in that we're really focused on more of a wellness model, whereas counseling is based on a very traditional model, a medical model. And counselors, especially licensed psychotherapists, would be addressing the past and helping you to look at your past so that you can spend quite a bit of time, usually, on the past in order to move forward in the direction that you want to move forward, okay? Mm-hmm. Whereas coaching, we also want to help you move forward as coaches, and we're facilitating that process. However, we spend very little time on talking about the past, just enough to give us a sense of where you've been and where you are now, and then we focus everything on how you're going to move forward. All right? So that's a key difference here.
Okay.
All right, comfortable with that, or any questions?
Sure.
No questions.
There are no questions right now.
Okay, good, all right. So when you called me, Jean, for this appointment, I understand that your boss, Mr. Klink, had suggested that you and Suzanne meet with me. Is that correct?
That's correct.
Okay.
Yes.
Can you talk with us a minute about that so we're all on the same page?
Sure. It seems to me that particularly lately, Suzanne and I have been having a little bit of difficulty communicating with one another. There's perhaps a little more confrontation and aggression in our interactions than I know that I would necessarily like. I just would really like to improve our way of communicating with one another in a more respectful and productive manner.
Okay, all right. Is that something that feels good to you? Is that why you're here, or is there some other reason that you feel you're here or would like to address while you're in a session today?
Yeah, I think we could do a better job, both of us, in
Okay.
communication.
Yeah.
Okay, all right. That was my understanding when you called. So it's good to know we're all thinking alike here, and that you're on the same page with Jean and Mr. Klink. Given that we just had such a brief conversation, but given our conversation, I did take a little time and put together a handout that I thought would be helpful if we talked about some thought patterns that sometimes get in the way of people's relationships, okay? And first of all, let me ask you the question. A lot of people don't know the answer to this. It's kind of a chicken or the egg question. But what comes first, thoughts or feelings?
In my mind, it would be thoughts.
Thoughts, okay.
I'd say thoughts.
Wow, 100%. Okay, I would agree with both of you. When I ask that question at workshops and trainings, I have 50% say thoughts, 50% say feelings, approximately. So it's interesting the two of you are on the same page today. That's great. Okay, there you go. It's true. I mean, the thoughts really come first, and the feelings are a response to whatever we're thinking. And that's important for me to bring to your attention now, because what I want us to do is talk about these patterns of thought that can sometimes get in the way of our relationships and make our relationships very difficult, because we can become very emotional if our thought patterns are negative thought patterns, okay? So you have a couple sheets in your folder. If you just want to pull out the first one and look at that with me. So what we would do is spend a few moments going through this list, see if you recognize any of these thought patterns in your own relationship with each other. And then if you do, then after we review this, I'll give you a chance to talk about that, okay? All right, okay. So the first one is pessimism. And that's a really important thought pattern to transcend. Because when we're pessimistic, it's totally a dead-end street for us. We cannot see our options. So if we cannot see viable options, then we're not going to be able to create those options, are we? So pessimism is something that if you are aware of it, and there actually are some wonderful scales and little quizzes that you can take to determine your ability to be optimistic versus pessimistic. If you're interested in that later, ask me and I'll give you more information. But pessimism, obviously the opposite of that is striving to be more optimistic. Criticism's the other thought pattern. That leads to conflict, always. When you're criticizing yourself or somebody else, it's going to either create that internal conflict or it's definitely going to create conflictual relationships. Of course, the opposite of that would be acceptance. All right? Control. Ooh, that's a big one. And we oftentimes see that in our families, we see that in the work environment. When we are controlling, we oftentimes don't see it in ourselves, but other people see it. And that's where the power struggles begin. And so if you've ever experienced that with each other or with other people, you want to ask yourself, is there some, are they perceiving me as controlling, or am I perceiving them as controlling? What's going on here? Sacrifice. Now sacrifice is another thought pattern. A lot of people think it's great to sacrifice, that really is a good thing. I would like to distinguish sacrifice from giving from your heart, giving from inspiration. So when people are sacrificing, they're giving up something. And that word up is a big, because when you give up something, if it's not inspirational giving, you will find yourself resenting. And when you resent something, you tend to take it out on other people. I think many of us have experienced that even growing up, where maybe parents felt they sacrificed for their children, and nobody really wants to hear that, because it doesn't feel good. It doesn't feel like somebody gave up their life for you, right? Right, wrong thinking, black, white thinking, be aware that that's a thought pattern that puts you into a box, and it creates lots of judgment, and it creates narrow-mindedness as well. Of course, the opposite of that would be what?
So open-mindedness, so being able to see the nuances between the polar opposites. Exactly,
yes. Being open, and that is such a wonderful trait, to be open-minded. Judgmental, what does that do? I mean, if we're judgmental toward someone,
It puts people on the defensive.
it really does, doesn't it? Yes, it really does create that mistrust.
Right.
Dishonesty, the opposite of that, of course, is honesty. Who doesn't want that in their relationships? I mean, that's the core, that's the foundation. Making excuses. Now that really, that's an example of a thought pattern that some people get into a habit of making excuses. They do. And sometimes it starts at childhood, sometimes it starts later in life, but to avoid consequences or avoid somebody getting upset with us. So it's easier to make an excuse. So be aware, and we'll talk about all these, but that does create dishonest communication. And of course, the opposite of that would be integrity, being truthful with one another, being truthful with yourself. The last one is making assumptions. So when we make assumptions, we really are setting ourselves up, aren't we? We're creating a foundation in that relationship not to trust somebody, because assumptions is not a truth, is it? Again, looking at something inaccurately and yet building on inaccurate information. All right. Any thoughts on this?
Not right now.
When we're going through this, have you thought about your own relationship? Because I would like you to think about your relationship with each other and tell us if you, and I'll start with you, Jean, and I'll circle back around to you, Suzanne, but do you see any of these thought patterns in your relationship with Suzanne?
Well, I think probably the one that stands out the most to me right now is that she frequently makes assumptions, and they're usually negative assumptions about something, about the reasons why I may do some of the things that I do or the decisions that I make.
So let me just interrupt you a second, please, and have you say that to Suzanne and tell Suzanne what you're thinking now.
Suzanne, sometimes I feel that you make negative assumptions about the decisions that I make in the office or the actions that I take, and you seem to take my actions personally, where there's no intent for that, and you react in a very hostile manner to me, and frequently in a very public and disrespectful manner to me. And I think it's the result of you making negative assumptions, always thinking that I've come to my decision in the worst way possible.
And let me just stop you a second, because you could actually be assuming that she's assuming. You know what I'm saying? Why don't you ask Suzanne if she feels she makes assumptions about the decisions you make or why you make, you know. Is that okay?
Suzanne, do you feel that that's true, that you do make assumptions and negative assumptions about things that I decide on?
I say that's probably fair.
Okay.
Okay. Well, thank you for admitting that.
So, well, you checked in with her,
Right.
again, so that you don't fall into the same trap of doing exactly what you're saying she does,
Right.
right?
Right.
It's easy to do that, but you want to pay attention to that pattern we can get into. Okay, so assumptions. Is there anything else, if we were to summarize some of the key things that didn't work for you in your most recent interaction with Suzanne? I understand there was some issue about, Suzanne, you did not get the vacation that you had put in for, so you were denied that vacation.
Right.
Okay. And Jean had just told me that briefly over the phone. So that's the most recent conflict between the two of you? Disagreement?
Yes.
Okay. All right.
Yeah, I had emailed Suzanne letting her know that I was in a position to have to deny her her vacation, and within minutes of my sending the email, she accosted me in the hallway and expressed her unhappiness
And
with my decision.
You can always talk, even though I'm sitting here, it's always best to talk to one another.
Right.
And so is that accurate, do you feel? Okay.
Sure. Yeah, I approached Jean in the hallway after reading the email. I was very upset.
Okay. Okay. So let's take a moment and just summarize, if this were to happen differently in a way that you could have accepted, okay, and you would have felt would have enhanced your relationship with Suzanne, even though you were disappointed with the decision that Jean made. What I hear you saying is that if Suzanne could have been calm, that would have made a difference for you.
Made a big difference.
So, Jean, if we were to summarize how the situation would have been could have been different for you and would have felt better to you. Let's summarize that. Let's paraphrase.
Well, I think what I would have preferred was if Suzanne had connected with me and asked to schedule an appointment to speak with me privately, and if she had approached me in a more calm fashion.
Again, talk with Suzanne.
Oh, I'm
Okay,
sorry,
that's
Suzanne.
okay.
Yeah, I would have appreciated it if you had asked to speak with me privately in my office to discuss your concerns about your vacation, and if you had simply been a little more calm in your approach to me and also a little more respectful, because you were very disrespectful to me at the time, and which is why I was disrespectful to you in turn. Not that that was right.
Let me stop you a second, and I want to remember the summary you just gave, because we're going to do something with this, okay? When you speak to somebody and you tell them that you did this to me, you were disrespectful to me, you were this to me, or you whatever, it does put somebody on the defense. So even as you're telling Suzanne that she put you on the defense, I want you to be aware of something, Jean. When somebody says to us, you did this to me, it feels bad to the other person. And we also give up our power. We become a victim here. And so if you can, this is just a tip, we all have fallen into that trap. It's an easy little trap to fall into. But this is a tip to stay within your power, okay? And so that maybe it will not feel like, to Suzanne, like you might be putting her on the defense, okay? So again, when you use I messages, you take back your power. If you said to Suzanne, I felt disrespected when you were speaking to me. I felt concerned. I felt embarrassed. There were other people around. When you say how you feel, it's a completely different message than when you did this to me.
Okay.
See what I'm saying?
Yeah.
It's like
Yeah, I do see.
victim in one stance, and like, why did you let that person do that to you is what I want to ask you, you know what I'm saying? And that's exactly what I hear you saying, that you don't want Suzanne to do to you, but at the same time, in speaking to her now, it's really easy to tell her that she did this to you.
Mm-hmm.
So if you can just be aware of that, shift your language to I felt a certain way when you said this.
Okay,
Okay?
okay.
Okay. All right.
Want me to do that?
I do, actually. I do, because I want to summarize our tips in a
Okay.
positive way,
Right.
because we want to take these tips and do something with them, okay? Okay, go ahead.
I would have preferred that you had scheduled an appointment with me to discuss your concerns privately, because the approach that happened made me feel disrespected and attacked and put me on the defensive.
I felt
I felt
disrespected
disrespected.
with the approach.
Yeah, I
With
felt
the
disrespected with the approach that you made
Mm-hmm.
with regard to your vacation time.
Do you see how that feels different?
Yeah.
I felt disrespected is taking back control.
Right.
You're in charge of your life, and nobody can make you feel any way, and you take it away. Okay. So
Okay.
if we take these tips then, Suzanne could have scheduled an appointment with you.
Mhm.
Suzanne could have been calm, could have been possible, even though you were upset and disappointed, you still can be calm to have it when you're having a discussion about this. And that Suzanne could have just discussed it in a way that maybe gave you a chance to explain it, rather than perhaps making any assumptions that you seem to experience here.
Right,
Okay.
right.
Or you thought that was
Yeah,
being
I mean,
made.
I feel like she felt
Okay.
like my decision was arbitrary and I was showing preferential treatment towards other employees, when in fact that's not the case.
Okay, all right. So what I want you to do, Jean, is I want you to take a few moments, and with that experience, I want you to kind of just experience sitting here and replay that in your mind. most importantly in this moment though, Suzanne, I want you to do the same thing. I want you to take what Jean has told you, and I would like you to replay the whole scene from the moment you read the email.
Come in.
Hey, Jean. Do you have just a second?
Yeah, Suzanne, sure. Come on in.
Thanks. I just wanted to touch base with you real quick. I just read your email about my vacation time being denied, and to be honest, I'm feeling kind of confused and pretty upset. So I've never had trouble getting my vacation requests approved in the past. And I also know that the other folks in the office have had their vacations approved, and I'm wondering if you'll talk to me a little bit more about that.
You know, Suzanne, I would be happy to talk to you about that. There are some reasons I want to make clear to you. So if you want to have a seat.
Okay, thank you.
All right.
So Suzanne, how was it? Were you able to get through the whole scene in your mind and doing things differently?
More or less. I'm really, I think, getting a handle on my anger was the most challenging to envision.
Okay. Were you able to get a handle on it, or?
I think so. I think so.
Were you stuffing it, or did you actually feel yourself releasing some of the anger?
I was probably stuffing it.
That's generally
Yeah.
what happens, and then it always comes back.
Mm-hmm.
When we find ourselves not sleeping at night, or eating all the wrong things to deal with our feelings of being angry that we've stuffed. So let me give you a tip about that, okay? One of the best things you can do when you're feeling angry is to focus your thoughts on how you want the situation to be. So in this situation, you read an email, you were upset, you reacted, and then you approached Jean. And then it snowballed from there. One thing you could do to calm yourself down is to say to yourself, when you get bad news or you're in the middle of an interaction that doesn't feel good, say to yourself, how do I want this situation to be? And focus your thoughts on the desire rather than on your fear. Okay, so the fear being not getting the vacation, not being able to change the situation or have Jean reconsider. And the desire would be to actually have Jean reconsider. So focus your thoughts on that so that you can see your options. Okay? All right.
Okay.
Good. All right. Anything else you want to say about the replay of the scene? Do you feel you were able to actually communicate with Jean effectively in your thoughts?
Yeah, in my replay, Jean was able to hear me. She
Okay.
wasn't initially on the defensive because I
Okay.
didn't approach her in anger.
Okay. Great.
Come in.
Hi, Jean. You wanted to see me?
Yes, Suzanne. Thanks so much for coming over.
Sure.
Hey, oh, have a seat.
I'm okay. I've been sitting all day. Do you mind if I stand?
No, that's okay.
Thank you.
Suzanne, I wanted to talk to you personally because I wanted to make you aware that I got your request for vacation, and unfortunately I'm in a position where I have to deny your
Really?
vacation. Yes, and I feel really bad because I know that you were very much looking forward to this trip the last week of August.
Well, that's really disappointing. You know, I have never been denied in the past, and I was just talking with Scott and Oliver, and they weren't denied.
No, I understand that.
Mhm.
Unfortunately, we have my concerns are this. You perform an extremely essential function for us. And your services are really valuable and critical to our tasks here. So I think you're aware that Brad, your backup, has given his notice, and I don't
Right.
expect him
Yeah.
to be here past this month.
Mhm.
So my problem is that I don't think I'm going to be able to fill his position in time for your vacation in August. So that's my problem. Now, if there's any way that I can do that, I will try, but my
Mhm.
concern is I can't guarantee it.
I see.
So what I'd like to discuss with you is the possibility that if there's some alternate dates that you could think of that would work for you, and I could make them work with our schedule, I'd be happy to work with you on that.
Okay.
I am sorry about this particular situation, but
Sure.
I will do my best to work with you so that we can accommodate your vacation time.
Okay. Well, thank you.
Okay?
Mhm.
All
Okay.
right. Well,
Thanks,
thank
Jean.
you
Yeah.
very much. I appreciate it, Suzanne. You have a great rest of the day.
Okay, thanks. You too.
All right.
Mhm.
Bye-bye.
So Jean, were you able to get through the whole experience, the scene again in your mind with
Yes, I was.
Suzanne? Okay.
Mhm.
And you were able to get through it differently, or did you keep reverting back to the way it actually occurred?
No, it played out very differently in my mind this time.
Good.
Yeah.
So actually just sitting here with Suzanne and the two of you having a conversation has really helped you to get to another place with this?
Well, I mean, it makes me realize how my approach was poor from the get-go, which in turn, resulted in a poor response from her. So, if I just started out on the right foot, maybe our interactions will go a lot more smoothly.
Well, and sometimes with people, you can start out on the right foot and they can still react. They could have a bad day. I'm not saying you would have, Suzanne, but they could.
Right.
And you're not going to be taking responsibility for them.
Right. Well, I can always at least approach it with the best foot
Yes,
forward.
yes, and be calm and be centered and
Right.
help them to see what they're doing. Yeah, I understand. Well, good. That's great that you were able to move through the whole experience. Sometimes people can't do that, so it's good. And both of you were able to today, so wonderful. It's about time to wrap up. I did include one more thing in your folder. Let me just take a moment and go through this with you. It's a summary of effective communication tips. A lot of these things we've talked about today, I just want to leave you with the summary and ask you to spend some time in your relationships, not just with each other, but with other people, kind of really trying to do these things, whether it's with your family, your colleagues, your peers, and certainly with one another. So if we were to do a quick summary, it's being calm, how important being calm is. It's the most important thing because everything else follows from that. Be open-minded. When you have something difficult to tell somebody, both of you in your situations did have something difficult or challenging you had to say. So we talked about steering the person to a private place or setting up an appointment, trying to do it face-to-face, and doing it compassionately with a lot of empathy. And truly letting yourself feel for the other person, not pretending, but truly feeling compassion for them. When somebody's angry, then again we talked about if somebody's approaching you and they're angry, always trying to be extra calm yourself and be aware if you are in a reactive mode, okay? Do more listening than talking, that's always better for all of us. That way you get a feel for what's going on with the other person. And then again, just be very empathetic, and if you are finding that you are having trouble with your own anger, remember to focus on the desire that you have for the outcome of that situation rather than letting yourself go with your fears. Is that a good summary? Anything else you want to add?
No, it sounds excellent.
Okay. Good. So I'm wondering if you would like to meet again and just do a follow-up in 2 to 3 weeks?
Sure, I think that would be great.
Sure.
Yeah,
All
thank
right.
you.
And I'll just let you set the agenda, the two of you talk about the agenda and let me know. But my thought would be just to kind of follow up and see how things are going and talk a little bit more.
All
Is
right,
that good?
sounds good.
Thank you.
So I'll let the two of you get in touch with me and we'll schedule, okay?
Okay.
All right, you have a great day. Really good to meet both
Oh, it
of
was
you.
lovely meeting you, Margaret.
Okay.
Thank you very
for your
much.
time.
You're welcome. Take care.